That we're going to be discussing today is going to be addiction. Addiction means the fact or condition of being addicted to a particular substance, thing, or activity. Oftentimes, when we're thinking about addiction, we think about alcohol, drugs, gambling. But today we're going to be focused on sex addiction. So the newer version of the DSM, which is the DSM-5, does not include sexual addiction as one of its disorders, even though there was a proposal made for the new DSM-5 to include sexual addiction as a disorder. So what would it look like to have a sexual addictions were in the DSM-5? The way that they would be diagnosed would be that over a period of 6 months, these are the characteristics that would be found on someone who did have a sexual addiction. One would be excessive time is consumed by sexual fantasies and urges and by planning for and engaging in sexual behavior. 2, repetitively engaging in sexual fantasies, urges, and behavior in response to dysphoric mood states such as anxiety, depression, boredom, or irritability. 3, repetitively engaging in sexual fantasies, urges, and behavior in response to stressful life events. 4, repetitive but unsuccessful efforts to control or significantly reduce these sexual fantasies, urges, and behavior. And 5, repetitively engaging in sexual behavior while disregarding the risk for physical, emotional harm to self or others. So sexual addiction, or the label of sexual addiction, is not only rejected by medical professionals, it is also rejected by society. When we begin to pathologize sexual behaviors, even behaviors that might be healthy, stigma comes attached to having a sexual disorder, such as addiction. With the stigma comes shame, guilt, and embarrassment, which might make people who have perfectly healthy sexual behaviors, like increased libido, feel like they might have a problem. Addiction or hypersexuality are still unknown and not really well understood, but there have been links to child abuse, child sexual abuse, or trauma that was experienced. People who use sex as a coping mechanism that have experienced trauma in the past are stuck in an addiction cycle. They first experience an emotional trigger, which results in them wanting to act out or release. From there, in this case being sex or some form of sexual behavior, from there, from the release point or the acting out point, comes a lot of shame and a lot of guilt on what they have done. And then they go back into a healthy state or a recovery state until they experience another emotional trigger and the cycle just starts over. The way to treat a sexual addiction would be to go to therapy, having the ability to identify their triggers, and finding new ways or alternative ways of coping, which will not result in destructive behavior.